Good day everyone, I am Daria May Gonzalez and student nurse from Our Lady of Fatima University. So in this video, I will be doing a procedure that is called immediate newborn care. So it includes here the immediate drying of newborn, initiating skin-to-skin contact with the mother and the newborn, also the early breastfeeding. I will also apply ophthalmic ointment on the eye of the newborn to prevent gonorrheal infection. And I will also administer two types of vaccines. The first one is vitamin K. It helps to the blood clotting factor of the newborn. The second one is the hepatitis B, which is it helps to prevent hepatitis B infections. We all know that newborns has a weak immunity because their immunity is not fully developed. So we administer those kind of vaccines to help them to fight back with the further infections or the infections that they might encounter. I will gather all the equipments and materials that I will be using in this procedure. Make sure to check all the materials if working and check it if it's clean because it is important because the mother and the newborn is sensitive to the bacteria. Before and after the procedure, always remember to do the proper hand washing. Okay, ma'am. 1, 2, 3, push. Push. Baby girls out. 9:30 a.m. After calling babies out, make sure to do the immediate drying of the patient. So while drying and cleaning the newborn, make sure to observe them. It is important to observe them, their appearance because of we will going to score them on the Apgar system. So the Apgar scoring is a way that we can identify if the newborn is giving us a good or bad performance. So if she or he have that bad performance, so we will give them a immediate medication or assessment because it shows that there's an unusual findings to the newborn. So the Apgar scoring stands for the appearance of the baby, the pulse, the grimace, the muscle tone, and the respiratory. So the perfect score is 10 points. So I am going to assess the newborn, observe her movements, and get her pulse rate. So I will be using my stethoscope to get her pulse rate. I am done assessing the newborn. So her appearance is pink all over the body, which is 2 points. The pulse rate is 110 beats per minute, which is normal, and it's 2 points again. For the grimace, the baby moves and cry, 2 points for that. For the muscle tone, the baby's arms and legs are flexed, which is 2 points. So for the respiratory is, as we can see, she's crying regularly and strong. So it is 2 points. So her Apgar score is 10 points. 10 points, it means in normal. So the total score of Apgar scoring of the newborn is 10 points. There's no unusual findings on her while doing and observing her doing the assessment. It means her appearance and performance is very good. So for the newborn, it shows that she doesn't have any problem. She will undergo to the post-delivery care. So once that we are done to the Apgar scoring, make sure to change the towel of the newborn because her towel is wet. This is the towel that we use drying her. So we will change it into a dry towel. So this wet towel, I will discard it and change a dry towel. I will also put her bonnet on her head. And I have here the identification bracelet. So I will place it on her foot because it is important to place it here. We can't place it on her arm because it might scratch her face because newborns might get some movements and scratch on their face. That's why we are putting it on her foot. So next procedure, nudge the baby into the chest of the mother and initiate early breastfeeding. So we can help the newborn to the positions if she or he is struggling to get a milk. Next, I will be doing anthropometric measurement. So it includes here, I will measure her head circumference, chest circumference, abdominal circumference, her body length, and weight. So before I proceed to the measurement of her body, I will transfer her into another bed to proceed with the anthropometric measurements. So by the help of tape measure, I will going to measure her head first. Her head circumference is 33 centimeter. So I will proceed to her abdomen. So after the head circumference, I will proceed to her chest circumference. Usually the chest circumference is minus 2 centimeter from the head circumference. So her chest circumference is 31 centimeter and considered it as a normal. So I will continue to measure his abdominal circumference. So it is 31 centimeter and it also considered as a normal. And for the length of the newborn is 21 inches, which is considered as a normal. The next one is the weight measurement of the baby. So I will put her on the weighing scale. The weight is 2.9 kilo, which is considered as a normal. Okay, next I will check the patency of the anus of the newborn. So I will be going to check it. So for her anus, I will going to insert my pinky finger on her anus. Make sure to do it carefully and insert it on the anus of the baby. Check the patency. So the patency of the anus of the newborn is very good. And also, while doing the observation, there is no unusual finding on her anus. So one of the most important procedure in this immediate newborn care is the administering the vitamin K and hepatitis B vaccines. But before I start into that, I will going to administer first the ophthalmic ointment of the patient. So this ophthalmic ointment is to prevent gonorrheal infections. So I will going to apply it to her inner to outer canthus. So I will apply it gently. And we can proceed to the vaccines. So after administering the ophthalmic ointment, I will going to proceed to administer the vitamin K vaccine. Always remember that when you administer a vaccines, make sure to use two different syringe, tuberculin syringe, because we cannot reuse the used syringe. Okay, I will use this tuberculin syringe. I'm going to clean her right leg, her vastus lateralis. I'm going to apply the cotton alcohol and clean it inner to outer and discard this used cotton balls. So I will going to administer the vitamin K. So I am going to inject it on her vastus lateralis. The position is 90 degrees. So I'm going to administer it. So after that, make sure to discard this syringe, remove the needle, and put it in the container, and discard it also. I'm going to put a cotton with micropore tape on her right side. So I'm going to administer the hepatitis B vaccine to the newborn. And I will going to get this tuberculin syringe, different tuberculin syringe, and I will going to use this for administering the hepatitis B. So first is make sure to clean the other side of the leg. Always remember that we cannot administer from the same leg of the newborn because it might put a pressure on them. So I will going to administer the hepatitis B from the other side of her leg. So I'm going to use cotton balls again and clean the injection site. I will put some alcohol and I will going to clean it inner to outer, and I will disregard this used cotton. Okay, so I will be administering the hepatitis B vaccine. So I'm going to inject it 90 degrees. There's no need to aspirate the syringe. Okay, I'm done administering the vaccine. So make sure the syringe, remove the needle, discard it, as well this syringe. And I'm going to put a micropore tape with cotton on her other side leg. So we are done applying the ophthalmic ointment on the eye of the newborn, as well as the vaccines, which is vitamin K vaccine and hepatitis B. So I will proceed now putting clothes on. So after putting the newborn's clothes, I will going to swaddle the baby. So I will going to leave the baby here and put a light.